And so the reason we did this is because on the market, there was just low doses, so 800 micrograms. I was having kids having to take full bottles a day. So number one, having a child take that many pills on top of everything else that we're asking them to do, the cost piece of it for families to be doing that was insane. And it was really not a good solution whatsoever. And so this is what came out of it, and we're having really great results, similar to what I would expect with leucovorin. It's the same form of folinic acid without the added ingredients.
Welcome to Demystifying PANS and PANDAS, the podcast where we uncover the mysteries, breakthroughs, and hope behind these life-altering conditions. I'm Dr. Nancy O'Hara, a board-certified pediatrician, educator, and advocate with over 3 decades of experience helping children and families navigate the challenges of neurodevelopmental and neuropsychiatric conditions, especially PANS and PANDAS. These disorders can feel overwhelming, but here we'll break down the science, explore transformative treatments, and share stories of resilience and recovery. If you've ever wondered what's possible for your child or how to find answers, this is the place to start. Let's dive in. Well, I am so excited to introduce to you a wonderful friend, colleague, mother, doctor. I cannot say enough great things about the person you're just about to hear and see, Dr. Lindsey Wells. So Lindsey, welcome and thanks so much for joining me.
Thank you for having me. It's such an honor to be here.
Well, Lindsey is an incredible naturopath. In fact, won Best Young Naturopath several years ago. She has a wonderful practice. We were in practice together, but we've expanded in different ways. And Lindsey now has a wonderful office. And as I said, she's an amazing mother, an amazing practitioner, and another expert on PANS, PANDAS, and all we do for our kids. So Lindsey, tell us first just a little bit about yourself, more than what I've just said.
Okay, well, I'm a naturopathic physician, and now my office is in Trumbull, Connecticut, and I focus my practice on children with PANS and PANDAS, other vector-borne diseases, autism, and my real reason for kind of getting into this field was to try to keep families together, because I feel like those conditions, it doesn't just impact the child, it impacts the whole entire family structure. And so my practice, I say, even though it's pediatric based, it is family focused, because I will also see the immediate family members of the child who has PANS and PANDAS or autism. And I feel like it really gives a beautiful, well-rounded view of how I can help to support not only the child, but the family. And when I feel like the parents are feeling well in all aspects, the child also feels better and we see improvement. So that's a little bit about me.
Yeah, and in your spare time, you even wrote a wonderful children's and family book. And as I always joke, it's a great book for those MDs and DOs that don't know anything about PANS PANDAS, but Super Sam in the battle against PANS PANDAS. So just tell us a little bit about that book first, and then the impact of PANS PANDAS on caregivers.
Yeah, so this was actually a maternity leave project that I did about 4 years ago. And it really stemmed, again, coming from my passion for helping to support family members. Because what we see with children with PANS, PANDAS, or any other type of chronic illness is they take up a lot of time and energy from the family, right? And it does impact the family structure. And often what I was hearing from parents was kind of the guilt that they felt about, the amount of effort and attention the one child gets over their other children. And they worry about that other child or other children, but the resources are going to the other one right now. And, I grew up with 2 siblings. I have a younger brother and sister, and my life is so much better because of them and having them in my life. But it was very clear the struggles that families were experiencing with one child who was sick and how that was impacting the other children in the family. So I wanted to provide a resource for families to use to read to the other children so that they could kind of understand that there wasn't a favorite in the house. There wasn't, there was really an underlying physiological, medical condition going on with the sibling. So it could just help to, number one, help the mental health of the sibling, but
Yeah.
also allow for that sibling to have a better understanding to keep that relationship strong between the parents and their sibling that was ill. And so, I feel like it's great for ages like 6 and above. And I've had some really wonderful feedback from families on how it allowed their child, like even reading it to their child who has PANS and PANDAS, like how it validated them and made them understand their bodies better. And they have been given donations to like their school and to their teachers to read to their classmates. So it's not just, I guess, about the sibling, but it's also about their peers and the child understanding themselves better.
Have you heard about cerebral folate deficiency? If not, or if so, this is a diagnostic test you need to know about. The Folate Receptor Antibody Test, or FRAT, detects autoantibodies that block folate transport to the brain, critical in conditions like PANS, PANDAS, and autism. Early detection means targeted treatment with folinic acid, improving brain function, reducing inflammation. So get the answers your child or patient deserves. FRAT testing may be the key to unlocking better care. And those at ReligenDX are revolutionizing diagnostic testing by equipping healthcare professionals with cutting-edge tools for early detection, targeted interventions, and improved patient outcomes. Their innovative solutions, including the Folate Receptor Antibody Test for PANS, PANDAS, and autism, provides critical insights into neurologic and immunologic related conditions. With a commitment to scientific excellence and personalized medicine, ReligenDX empowers clinicians to make informed decisions and optimize treatment for every patient. For more information, please visit fratnow.com or religendx.com. Yeah, and I think for the practitioners that are listening or watching, having the book in your waiting room or copies of the book. I have a practitioner I work with that asks for copies all the time, and it's available on Amazon. You can very easily buy 10 copies to have in your office and give it to your families. It's not expensive, and I think it tells the story well about what PANS and PANDAS is at a way that it's understandable, and also gives a message of hope, not just for the kid that has it, but for the family.
Yes. And so it's essentially just talking about like the superpowers of the family at the end and the strengthening of the family unit and how the family dynamic might look different, but they're still super in their own way. And so I really wanted to make it encouraging for the whole family and the child who reads it.
Yeah. So what are you seeing when PANS PANDAS affect a family? What are you seeing in the siblings and the family members, and what do you do to help them?
It's a great question. I feel like our kids in general are getting sicker. I'm sure you would agree with that.
Yeah.
And I used to not see so many, like when one child had PANS PANDAS, it was like that was enough for that family. That's plenty. But unfortunately, what I'm seeing is that it is running in families. And so one might be the most ill, I guess I would say, or the most affected, but the other siblings, or maybe one sibling, will start to have some soft signs. And so what I encourage family members to do is to establish care quickly with those other siblings, like at the first onset or inkling or gut feeling that there's something that could be going on with the other child. It's just establishing the relationship with their PANS PANDAS provider so that if anything were to progress, we'd be able to quickly nip it, because we know how difficult it is, number one, to get the correct diagnosis, and then sure as heck to get the right treatment, and how with every subsequent flare, things can get worse. So luckily, what I've been seeing in my families of when we're approaching a case like that, it stays extremely mild and it really doesn't progress to anything more because we have them on that three-pronged approach. It's like a gentler, more balanced, not as aggressive approach, right? But it's still a prophylactic antimicrobial, some symptom support. And what I see really with the kids is like the siblings is some anxiety, some OCD, some ADHD type of symptoms, right? And then, of course, we have the immunomodulatory, so like a very benign anti-inflammatory in there. And
Yeah.
that seems to be working really well for my families. And it's just trying to decrease the stress of having another child go into a more severe
Right.
case. What about you?
And why do you think that is? I mean, we both know, as and probably everybody on here knows, there is a genetic predisposition, so that's certainly possible. And we live in a very toxic world. Certainly,
Right.
mold may be affecting everybody in the household, or more than just the index sibling. Any others that you think about why it's affecting the other family members?
Yeah, I mean, one suspicion that I have, and I think you would agree with me, is just the prevalence of tick-borne disease in people in
Yeah.
general. And I really believe we're pretty much all walking around with it, but some of us have that genetic susceptibility to actually present with symptoms. So it's very likely that mom and dad may have had or have some vector-borne disease that's then being passed. And I think that kind of is just it sits there maybe in that child, and then it's an infection like strep or mycoplasma that just pushes it over. So I think that's part of it, and I have strong suspicions for that. But I also think it's just the environment that we live in general, where our food sources are depleted from nutrients. There's so much inflammation, the toxic burden that our children have, and it's just unfortunately there is that genetic piece. So all of that combined then leads to the manifestation of PANS and PANDAS occurring.
Absolutely. And I think the other piece that we talk about a lot, and I know you do a lot of work on, is helping parents, particularly moms, put their oxygen mask on.
Oh,
Because, whether it's they're so tied up in dealing with the sick kid
mhm.
that they may neglect the other one or neglect themselves. And I speak to that a little bit too.
Yeah, so absolutely. I feel like it's more of the neglection of themselves more than
Yeah.
anything, right? And so again, I am a firm believer that when a parent takes care of themselves, and they feel better inside, their child feels better without us doing any intervention. And I did a small survey in our practice actually, and 50 mothers responded, which I thought was pretty amazing. And the results were over 80% agreed that they notice when they're not feeling well. So like say they're feeling anxious or overwhelmed, they notice an increase in behaviors in their child. And so this is not just for children with PANS, PANDAS, this is also other chronic diseases, including autism. But what's been amazing is to see there is research coming out now about caregiver burden in PANS and PANDAS.
Yeah.
And what was most shocking was the first one that I think came out, which was probably about 2 years ago. It was kind of they included a narrative where they interviewed parents and then they included quotes from them. And it was the quotes that we hear in the office all the time. Like, I felt like I lost them. Every single time they have a flare, it's feeling like I'm back to the beginning and the trauma that comes with it. And like feeling like I couldn't do anything besides take care of them. Like I felt like I couldn't even breathe.
Yeah.
And it gives me chills to think about because it is significant, the burden here. And they actually were even comparing it to taking care of somebody with Alzheimer's or taking care of a child with Rett syndrome, which is
Yeah.
significant. And how the ups and downs of the flares make it so the nature of this illness, not only so challenging for the child, but that caregiver, because we're in that constant state of fight or flight. And unfortunately, as we know, there are flares. So anytime a little flare happens, it's like as a parent, you're jumping right back to the beginning of like, oh my God, what is this going to look like? And that's then not helpful for, our children pick up on that type of stuff. And it's important to prioritize ourselves. It's important to recognize and work on ourselves and to regulate ourselves and to not feel guilty about that either. And
Right.
I have a membership group where it's moms. It's called the Well-Minded Mamas Club, where it's all moms who have children with complex medical conditions, PANS, PANDAS, autism, tick-borne disease, mold disease. And it's fascinating, the commonalities between all of us and the community. And we have similar feelings, but experience it in a different way because every family is different. But the research is out there, the communities are out there of moms, but it's still so, we could say all this, but it's still so hard to implement it.
Right. Right. And I think, your Well Mind is Mama's Club, I love it. Just the way you provided an online community for moms and provided resources, provided, discussion, all of that. But also, help with the day-to-day, just taking that extra breath, going outside for those extra few minutes, taking that cold shower, being in the dirt, in the, the sun, whatever it is, so important because as our kids are so symbiotic, sorry, dads, but with us as moms, that they feed off of our anxiety, whether it's PANS, PANDAS, or anything else.
Yeah.
So,
and one technique I've been finding very helpful for some of my moms in the group is just something called the physiological sigh. I don't know if I've shared that with you, Nancy, but it's just breathing in through your nose, kind of getting to the top, and then breathing in again, and then letting out a little exhale through the mouth. And so it goes, and it can be an audible sigh or not, and repeating that. And actually, research has shown that that particular breathing technique was more effective for shifting people into parasympathetic tone compared to 4-box breathing or some meditation. Now, they were saying it at 5 minutes. I think that's a long time to breathe like that, but I think even doing like 3 of those breaths, like before we respond to something, just to regulate ourselves. And the other thing I've been working on is I'm calling it a mom timeout, where we're literally just taking a few minutes, intentional minutes to be like, I need a few to refocus, to breathe, to rebalance before I show up again, and kind of working through that mom guilt that we have of stepping away. But the benefits that come from that are so profound. It means way more than the 5 minutes that we take to recenter ourselves.
Right. And we're modeling it for our kids.
Absolutely.
We're showing them, and also, mommy needs a timeout. And just breathing in front of them just can go so far. I mean, we talk so much about medications and herbs and nutraceuticals and, CBT and DBT, but just these simple lifestyle things can go so far to help our moms and our dads. We don't want to leave them out, and our kids and their siblings.
And the whole purpose of this is to empower the parent, rather, like there is no guilt, there is no shame, there is no blaming here whatsoever. It's just empowering you to realize that you hold a lot of power, actually. And we can view it as a burden, or we can actually view it as something that is very beneficial and, again, powerful and beautiful to have such a deep connection with our child that when we take care of ourselves, everyone else around us benefits, including them.
Yeah. And we've thrown around a few things, and, we never know, our listeners, our viewers, some of them are practitioners and are, way down this road. Some are just listening to this at random and never heard about PANS and PANDAS. But I want to just highlight a couple of things you said, because I think it's important. You mentioned the 3-pronged approach, which of course we certainly believe in. The antimicrobials, doesn't need to be antibiotics, the immune modulatory therapies, and which can be as simple as ibuprofen, but lots of, again, herbs, botanicals that are so good at that. And then the symptom support, including therapy and including, again, nutraceuticals, et cetera. Do you want to expound on any of those, one of those that, are really important to you?
I think the biggest one that I see being left out is the prophylactic antimicrobial support. I don't know about you, but I feel like we focus a lot on the symptoms, which I understand because we want the child to have relief. We want the family to have relief. But I often think we're still missing the underlying cause. And if we're treating the symptoms and we're putting in immunomodulatory, but we're not putting in the antimicrobials, we're leaving that child, we're not doing our due diligence, I think, to prevent a future flare and perhaps it getting worse. So that's the biggest one that I see when people come to the office and say they have been treated for PANS and PANDAS, they've been under the care of others. It's that prophylactic antimicrobial that is pretty amazing to me that that's usually left out.
Yeah. And we're not talking about long-term antibiotics. They can do it herbally.
Absolutely.
Yeah. So, and then you mentioned about our sympathetic,
Oh,
parasympathetic, and I
yes.
think we should just define that a little bit better for
Yeah.
people that may not understand what that is.
Yeah. So the parasympathetic mode, it often has to do with the vagus nerve or the limbic system. And essentially what this is just getting into that fight or flight, which we can see in our children, right? So we see that their pupils are dilated. We see that they can go from 1 to 100 in a split second. We can see that, well, we can't see this, but they might say that their heart is racing, or they might get an upset stomach and have to run to the bathroom. Or not be able to fall asleep at night because they're worried. That's all that fight or flight. And I think a lot of parents know that. They can recognize that in their kid. What we, sorry, yeah, what we really want is to go to that. Did I mess up and say that it was parasympathetic and not?
You started with
Yes.
parasympathetic, but
I
that's
started
okay. Yeah, I think
parasympathetic.
everybody, right,
So
right.
we know, but essentially
Yeah,
the parasympathetic is that rest and digest. And
right.
that's like when we're able to calm the nervous system and we're able to, you know, just relax essentially. But our kids unfortunately are in sympathetic, excuse me, and that's that fight or flight where we see all those symptoms that I was talking about.
Right.
And so
And you go.
what we want to focus on is more of like, how can we shift from that sympathetic nervous system to parasympathetic? And that's really focusing on like that vagus nerve and that limbic system. And that's the simple things like breathing, right? That could be making sure that we're getting enough sleep. That could be making sure we're pooping every single day. One that I love that I find so easy is humming, actually, because humming vibrates that vagus
Yes.
nerve and shifts us into parasympathetic. So sometimes I have patients or parents come to me and be like, they're humming, or they're humming to themselves during certain periods of time. Like, is that a tick? Is there something wrong? And it's like, not at all. That's just them knowing that this is a self-soothing mechanism to help shift them when they're feeling anxious or they're feeling dysregulated into that more parasympathetic mode. So that's super simple to hum.
Yeah.
So
Yeah, and I think that's a great one. I remember just a few weeks ago, I had a kid come in that was one of our spellers that could never express herself before. Now she's spelling and can express herself, but all these years she's been humming, sometimes softly, sometimes really loud. And in asking her, that's just what she was doing. This was the only thing that could bring her out of that fight or flight, that huge sympathetic, limbic vagal. Blah. Yeah.
yes.
So, and then the other thing that you mentioned that I know both of us are passionate about, but I know you do such a great job in treating is tick-borne disease,
Mhm.
and treating herbally, which we both agree has such benefits and good research behind it.
Right.
And being in the Northeast, it's more than 40% of the ticks have Borrelia, Babesia, Bartonella, and you've done a lot in working with these kids. So do you want to just mention a little bit about any one of those?
Yeah, so I think I have a big passion for Bartonella, as you know, and the reason I am so passionate about it is because when kids are presenting with dysregulation, when they're presenting with anger and aggression and rage, like that's not their normal state. All children want to please. They want to be loved. They want to be nurtured and like, praised. And so they don't want to present like this. And so it was just so fascinating going through like the years and my clinical experience, just seeing the pattern of like these children, they don't want to act like this. And I truly believe it. And there is a reason underneath, and that's that tick-borne disease, in particular, Bartonella. And I also find it so interesting about sensory sensitivities, because that's another big one that we see, especially in the autism population as well. And then to see how that's connected to Bartonella or Babesia. And so what I really see is those are the two that I rule out the most. I know that Lyme disease and Borrelia burgdorferi and relapsing fever Borrelia and ehrlichiosis and anaplasmosis, all of those are potential as well. But when it comes to PANS and PANDAS, clinically what I see is it's more commonly Babesia, Bartonella, same thing with autism. And I feel that when we first started, like I first started my career with PANS and PANDAS, it was possible to see a PANDAS case, like just strep, where it didn't turn, it wasn't PANS. I don't see that anymore. It's,
I know.
our kids are sick and they're being affected by all types of germs. But what I also would see a lot of is the waxing and waning pattern of like, they would have a flare for extended period of time and then they would get better and not have a flare and like return back to baseline for, again, extended period until we had the next one. I don't know about you, but that is not what I see in practice anymore. I call them constant flares where the child has the onset and then it's just very difficult to get them back to baseline. And when that occurs, in my approach and how I look at that case is like you have to rule out vector-borne disease, particularly Babesia and Bartonella, yeast overgrowth and mold disease, but often with neuropsychiatric symptoms, it is the vector-borne disease. So I feel very passionate about ruling that out and also uncovering that and treating that. And
Yeah.
it makes a significant difference in the child's
Absolutely.
symptoms.
And I think we would both agree that like PANS and PANDAS, Bartonella, Babesia, we cannot diagnose by conventional labs. And in fact, these are really clinical diagnoses. So if you have the index of suspicion because of the daily rage or because of the severe night sweats or because of the striae with Bartonella or whatever the symptoms may be, treating herbally is safe and effective.
Yes. And so what I see is I don't see a difference in the length of treatment or even the outcome when we're using antibiotics versus herbals. I do tell people if they use antibiotics, I will always support them in whatever they choose, but you should put in the herbals as well because you're going to be treating for a long period of time. These are very stubborn germs, so a minimum of a year. You should expect at least 2 years. And I'm always like celebrating after a year of testing and like we got an infection down or like resolved. It's like it's a celebration rather than some people being like, oh, but it's not totally gone. It's like, yeah, but you got one down or you got it's for a celebration. So but what's also interesting is I think it was the American Academy of Pediatrics. They put out their own paper in 2020 where they looked at the most common cause of infectious encephalitis in children. And guess what the number one bacteria was that caused encephalitis in children? It was Bartonella.
Yeah.
And shockingly, how many pediatricians are actually looking at Bartonella? I think I can count on one hand how many people have come to me with conventional labs, just through the standard lab, where a pediatrician ran Bartonella, which is very sad. But then also, if you have the standard lab and the Bartonella comes back negative, you can't necessarily trust that because it's only looking at 2 species, right? So it's only looking at Bartonella quintana and Henselae. And same thing with Babesia, microti and Duncani, when in reality, there's many different species there because it's a family of germs. And so that's why we have to go more to the specialty testing because we're ruling out pretty much all of them that we know of.
Yep. And I agree with you that we're seeing a lot of kids with daily flares, but we're also seeing some with the waxing and waning. And some of that is because these diseases particularly may go dormant, may go deep within cells with, in the body. And one measurement in time from a conventional lab that's only testing 2 of the many strains, you're looking for a needle in a haystack. Whereas if you have the symptoms and can treat it safely and effectively herbally, it just makes so much sense to me.
Absolutely.
So I'm so glad that that's one of your areas of passion because I think you're helping a lot of kids in doing that.
Thank you.
But one of your other areas of passion and one that you totally took the lead on and did all the work for was the article that we published with you as the lead author this summer on folate receptor alpha antibodies in children with PANS and PANDAS. So I'd like you to talk about everything about that, about cerebral folate deficiency. So start wherever you want to on that. And
so I think we were looking at cerebral folate deficiency quite often in the autism population, right? Because it's most commonly, tested for there to help with speech and communication and language challenges. It's also a manifestation that can occur in epilepsy. But what's lesser known is that cerebral folate deficiency can occur in treatment-resistant depression, anxiety, psychosis, schizophrenia, memory loss, dementia. now, does that sound like any of the symptoms that we have for our children with PANS and PANDAS? And so with that, we started to investigate in our initial consults, which I really loved that we did it in the initial consult before we got on a lot of treatment, right? And what we found was that about 64% of our children with PANS and PANDAS have cerebral folate deficiency. And when we treated them appropriately with high-dose folinic acid, what we found was that there was improvements in their symptoms. So improvements in OCD, anxiety, depression, tics actually was a big one too. And one area that I'm exploring that I'm kind of excited about, because I have one case study, is speech disfluency, which we know children with PANS, speech disfluency, the article showed about 54% of children in a flare will present with speech disfluency. So that could be like stuttering or putting in unnecessary words, selective mutism. What in one case study that I have, that child has cerebral folate deficiency. When we put in high-dose folinic acid, their stutter completely resolved.
Wow.
And so I think that kind of gave us, I got that kind of thought just from the children with autism and the speech and communication piece. And then I am seeing that kind of follow over with PANS and PANDAS and that symptom in a flare. So I guess I feel like it's very possible that cerebral folate deficiency is a part of maybe why a child is susceptible to PANS and PANDAS or the manifestation of their symptoms.
Right. And as you reported in the article, small numbers, 47 kids, but 63.4% had cerebral folate antibodies. That's not a small number. And as you said, the symptoms really overlap a lot. So it should be something that's looked for. So just taking a step back first, just talk a little bit about the pathophysiology of cerebral folate deficiency so people understand what's going on.
No problem. So I'm sure you've heard of folate. Folate is known as vitamin B9, and we hear a lot about folate and the importance during embryogenesis or when we're pregnant, right? That we need to take folic acid, which may not be the best form for somebody, but still, nonetheless, we know the importance of folate. And when somebody doesn't get enough folate during pregnancy, it can lead to neural tube defects. It can cause a child to be more susceptible to neurodevelopmental disorders. But it's also extremely important in RNA and DNA synthesis, amino acid metabolism, neurotransmitter synthesis, myelin production. There's so many areas that the body needs folate. And when somebody has a folate deficiency, we think about, okay, anemia. That's a very common thing we think about. Other pancytopenias, other immune dysfunction, neurological disorders, but also mental health disorders. And what we have found is that you can have very normal levels of folate in your serum. So when you check the blood, your folate levels could be completely normal, but that doesn't necessarily mean that you're getting enough folate into your brain. And so what cerebral folate deficiency is you just not enough folate in the brain. And there are many reasons to why this could happen. There's about 5 different potential reasons and mechanisms to not be getting enough folate in the brain. But the one that we focused on in our study, and what I think the majority of studies look at, is the receptors on the blood-brain barrier specific for either folinic acid or methyl tetrahydrofolate, known as folate receptor alpha. What can happen is that there can be antibodies that the body produces that either block or bind to the receptor that doesn't allow your body's normal levels of folate to get into the brain. And so the solution is to essentially load the system with folinic acid to the point that the brain utilizes a different carrier transport. It's called the reduced folate transport that then shuttles that folinic acid and methyl tetrahydrofolate into the brain. And that then helps to normalize the levels. And we're so fortunate that we're now able to test this through blood. Previously, this was only available through a spinal tap and looking specifically at the cerebral spinal fluid. But what we've seen is that when you do the spinal tap with the the spinal fluid, it's very similar, the results, to what we're seeing in blood. So this is like a less invasive way to be able to diagnose somebody with cerebral folate deficiency and then get them the proper treatment, which is essentially high dose folinic acid that's based on their weight.
Right. And for those of you who want to look into that, the website is fratnow.org, FRAT, so Folate Receptor Antibody Test, now, NOW.org. And it is a great test. And just from your perspective, I'm curious, Lindsey, we know about the research that Dr. Fry, Dr. Rossignol, Dr. Raymaker, Dr. Quadras have done, and I'll be interviewing Dr. Fry also on this podcast, talking about this in autism. But from your perspective, this blockage, these antibodies, do you think that it's something lifelong in our kids with PANS and PANDAS? Do you think it's a cross reactivity? What's your thought about that?
I think it is more lifelong, because just thinking again about the nature of PANS and PANDAS, how it is a pediatric, disease and illness, but there's like 2 periods in time where it resolves, right? Where we're thinking puberty or adulthood when the blood-brain barrier closes. But although our children they outgrow this, they still have some inklings of a little bit of OCD or anxiety, or maybe when they get stressed, a tic will come out. It doesn't interfere with their life to the extent, but we still see some of that. So I'm suspicious that this is more lifelong. It just how it manifests and how drastic it is might change, but we do know that the folate receptor autoantibodies, they fluctuate throughout life actually and at different times. So again, it would be interesting to look at in our PANS community, like the kids who are in flares rather than the ones that aren't in flares, like what those antibody levels look like. But we know diet plays a role too. And I'm sure Dr. Fry will talk about this, about how the folate receptor autoantibodies, we're seeing those in parents as well. So if you have a child with it, you were seeing that it's also present either in mom or dad or both, and even in some of the siblings who are not affected by autism. So there's a very high suspicion that this is a non-genetic heritable condition. And so I do think it is in our population lifelong. It's just we might not need to be aggressive in treating it for lifelong because other burdens in general are coming off of our kids, but I do think we need to treat longer than maybe we previously expected or thought we did.
Got it. Now you mentioned diet. The big one that parents need to be aware of is that milk, all animal milk protein, also block these receptors. How do you talk to your families about that and implementing that?
I find that them taking the high dose folinic acid is much easier for them than to implement the dietary change. But I do kind of tell them, like, if you're not taking out the dairy, we're kind of just chasing our tail. Because what was really interesting, it was an article by Dr. Raymakers. I mean, this was a while ago now, looking at a milk-free diet. So it wasn't a totally dairy-free diet, and it was also only cow milk. But when somebody took out that milk, what they saw was there's a drastic decrease in the autoantibodies. But yet when they reintroduced the milk, what happened is it spiked even higher than what it initially was. And so the reason this happens is because our body will, like the homology is very similar between the folate receptor alpha from milk and then also in our body. And so I think this is also a reason as to why we see autism, like it's more common, the diagnosis between say 12 months and 18 months, because I think that's when, in America, we're told to give more cow milk, right? As like a supplement for breast milk. And that should be a really big source of nutrients for them. But that's a little bit off topic, but I do think that's why we see the changes maybe in development around that time if the child has, autism and the cerebral folate deficiency. But the other piece of it is, even though the research is only saying cow milk, it really comes down to all animal milk and dairy.
Yep.
So I've had patients ask about like cow, sheep, buffalo. Most recent one was a practitioner about donkey milk. And it's like,
Camel milk.
yeah, oh, camel milk.
Yeah.
Yes, you're right. And so it's my advice is still to avoid all animal dairy because what the research shows in regards to the ability, like the homology of the similarity between the structures, it's across all of the animals rather than just cow milk.
Yep. Yep. Totally agree. And there are so many milk alternatives that we have available for our kids that are very healthy. I mean, we may want to avoid all the rice milk and certainly soy milk and maybe not too much oat milk either, but there's pistachio milk, there's almond milk, there's coconut milk, so many out there that are available to our families to consider that our kids will like,
Tastes way
So.
better now than it used to.
Yep,
So.
absolutely. And then, as you mentioned, folinic acid gets around that block through the reduced folate carrier, and we want to use very high dose. Certainly in FRAT and Dr. Rossignol's and other studies, it was 2 milligrams per kilogram. And, you and I have talked about how silly the Connecticut legislature is in not letting naturopaths prescribe medications, but all of Dr. Fry's studies and others were on leucovorin, which is the prescription form of folinic acid. But now you have come up with a high dose folinic acid that's available as a supplement. Can you talk to everybody about that?
Yeah, so this was really birthed out of frustration. I think that my families weren't able to get the treatment that they needed because of the limitation of the scope of practice. And even if they were able to they had a physician that they could work with that could prescribe, there was a lot of pushback if they weren't in our community because leucovorin, unfortunately, is characterized as a chemotherapy drug because it's a rescue for chemotherapy for the depletion of folate when you're going through that treatment. So without really looking into it, a lot of physicians were like scoffing at the idea of prescribing it. The other thing about leucovorin is it does contain some dairy product in it too, depending on where you get it from. So it's kind of counterintuitive for us, right, to be telling somebody to come off of dairy, but yet putting them on a medication that contains that. Also, there was supply and chain issues. And so this was, as I said, birthed out of frustration. And so it is a product. The company is called Emphysys. It's EMEPHYSIS. There's only one product there. It's called high folinic. And in one capsule, we get 15 milligrams of folinic acid. And so the reason we did this is because on the market, there was just low doses, so 800 micrograms. I was having kids having to take full bottles a day. So number one, having a child take that many pills on top of everything else that we're asking them to do, the cost piece of it for families to be doing that was insane. And it was really not a good solution whatsoever. And so this is what came out of it, and we're having really great results, similar to what I would expect with leucovorin. It's the same form of folinic acid without the added ingredients, and I'm really proud of it, and I'm really happy that it's an option for people.
Right. And so again, it's Emphysys, EMEPHYSIS.com. But you do recommend that parents work with a practitioner to make sure that they're using the correct dosages, et cetera, in getting it. So
absolutely. I do think, there has in some of the research, they say that like there's minimal side effects. So if you want to do a trial of high dose folinic acid, I am not in that camp. I really think you should know if your child has cerebral folate deficiency or not before you implement the treatment. The reason being is you're already doing so much with your kid. We already asked them to do so much. It's one more thing. It's really great to have the data before moving forward with this, because it also isn't like you just go up to the dosage of the weight appropriate dose. You have to build up to it. It's a commitment. There could be some side effects from it, not serious, but still some side effects. And so you have to work with somebody that understands, that can help navigate you. And again, your number one job is to be their mom or their parent. You're not supposed to be their doctor too. And so my hope is that you can find somebody that is familiar with cerebral folate deficiency and help with guidance for treatment with that.
Yeah. So I think it's, I know you've gotten a lot of great feedback on the study, and I think it's really an important piece that goes beyond the scope of the three-pronged approach that we were talking about before, that goes beyond the tick-borne disease, the mold, all the things that we all see that I think practitioners and families need to ask about and look at. So I'm so thrilled you did that, and keep me abreast next time you're going to do another one. But that, I think it could be another game changer in this population. But as you said, in many other kids, not just PANS, PANDAS, or autism, but others with anxiety, depression, epilepsy, sleep disorders, speech disfluency, whatever it may be, this could be something that is affecting their child.
Absolutely, or affecting them too in the adult population. And so, I'm really proud of us for getting that information out there, because I do think it's a significant finding for our population, and it just sheds light on the fact that cerebral folate deficiency, you don't just have to think about it for autism. You don't just think about it for epilepsy. There's really a lot of mental health conditions that it can make a significant difference for. And even the thing that I love about it is, if part of that symptom support is you putting on an antidepressant or an antipsychotic, if your child's not responding as well to it, or as what we would hope, which we know children with PANS, about 50% of them don't respond the way that we would hope for. Either they have side effects, or they can't go up to the tolerated dose. Adding in folinic acid or methyl tetrahydrofolate can potentiate that medication to make it work better. So again, all it comes down to is like getting your child or you more relief from your symptoms, and making maybe some of the other interventions that you've been putting in more effective.
Yeah. Yeah, absolutely. All right. So we've talked about your book and the Well Mind is Mama's Club and the article on cerebral folate deficiency. You also have a course that's called PANS, PANDAS Power. Tell the moms and dads and everybody out there what that's about.
Yeah. So this is a course that I put together mainly for parents who have suspicions that their child could have PANS, PANDAS, or if they're having a really hard time getting into a provider. And so it's supposed to be that interim, because unfortunately, this condition, there's urgency behind it. We need to get our kid relief. We need to get them out of a flare. We need somebody to listen to us. But then all the people who are specialists in this area have extensive wait lists. And this was a way that I felt like I could kind of maybe combat a little of that, to get the child and the family some relief. So there's modules in there about what is PANS, PANDAS, about the three-pronged approach, antimicrobials, immunomodulatories, and symptom support, as well as what to do as the caregiver, how to manage flares. And it's all based on naturopathic supports that you can implement now. And so it's PANS, PANDAS Power to get you the relief for your child now, not waiting 9 months to see somebody, 18 months to see somebody. And, so that's what that is. And I'm proud of it. And I think it is very helpful. And there's a lot of information in there. There's, resources, there's some dosing instructions, like there's the herbals to consider. So I feel like it's very jam-packed with what you might need. But again, the goal is to still work with somebody when you can get in, but it's kind of that in between when you need something.
Yeah, I like the now part of it too, because it is so unfortunate that so many of us have such long waiting lists, you included, and that we can't be there for everybody. So having a course like this is invaluable. So I want to ask you, if you had to go back to your younger self, like maybe in naturopathic school or even before that, or when you first started, is there anything you would tell yourself differently, like knowing what you know now, anything that you would tell your slightly younger self?
I would probably tell myself to just continue and to trust, and that, because I feel like what got me on this path was a little confusing. I don't have a child with PANS, I don't have a child with autism. And I sometimes contemplate, like, how did that younger Lindsey know this was the way she should go, right? And, you know, my gift that I have gotten from working from this community is really the moms and the parents, and seeing how they're so devoted, so determined to get their child well, how the unconditional love that you really teach me how to be a mom. And that's the greatest gift. And so that's what I want to give back. And I think I would also, pat that younger Lindsey on the back for being pretty persistent in her life, and, thinking, if I don't hear, just keep going until you hear a no. And I think that helped me in my experience and in my journey to working with you, Nancy, right? Like, many people don't know this, but I think I harassed Nancy for a long time with no response back. And I just kept going and going until I got a response, which was, sure, we can meet. And it ended up being a beautiful, like, it still is a beautiful relationship, but when that time of us working together, but I think it came from my persistence of being like, until I hear no, I'll keep going, so I guess.
Absolutely. And I, for one, am very, very glad you did. And my life is richer for having, made you work so hard to do it, even though I have no recollection of the not answering. But I am so glad we had our years working together, and so glad we have this stage in our lives to continue to be in each other's lives. So, and I'm so grateful, as all the parents who work with you are, for all the things you're doing, your book, your clubs, your course, and the care that you give to all of your patients. So any last words you want to leave our families with?
I really want to leave the families that are listening to continue to trust your gut. You know your child better than anyone, and so don't doubt yourself, and you really are doing an amazing job. So on the hard days, be gentle with yourself, because your child is so lucky to have you. And so I mean that from the bottom of my heart.
So true, and so important for our parents to hear. So thank you. And again, tell people where they can find you.
You can find me at my website. It's lindseywellsnd.com. All of my information is on there. My office address, my phone number, the email, the Well-Minded Mamas, the course, everything is there. And if you want more information on the high-dose folinic acid from Emphasis, you can always reach out. But you could find that there, or find me on Instagram. I'm not as active as I used to be, but I do love to post about the research and talk about Bartonella and PANS and PANDAS. So you can find me there.
Yeah. So LindseywellsND.com, and it's Lindsey with an E, as it should be. And thank you, Lindsey. I so appreciate you being on, and so appreciate all the work that you're doing. So thanks for being here today.
Thank you.
That's it for today's episode of Demystifying PANS, PANDAS. I hope you're walking away with insights, tools, and hope to help you and your child on this journey. If you found today's conversation valuable, be sure to subscribe so you never miss an episode. Share this podcast with anyone who might need it. It could be the lifeline they're searching for. And if you have a moment, leaving a review helps us reach even more families who deserve answers. Also, for more information, training, and community, check out our website, drohara.com, and join our annual membership. And remember, every step forward, no matter how small, brings us closer to healing and understanding. Until next time, be present, be hopeful, and we look forward to seeing you next time on Demystifying PANS, PANDAS.